Hi, my name is Superintendent Chris Gable. I'm the officer in charge of the Kelowna RCMP.
And when did you start?
I started here in July of 2024, and I was officially named the officer in charge in July of 2025. There really isn't much in terms of policing that I haven't experienced being in small rural communities, being in large municipal detachments. I've worked in and had leadership roles in some of the most complex, large detachments in the province. And I've also taken leadership roles or worked in most units that would be required in a community such as Kelowna. So I have a wealth of experience to draw upon, and throughout those experiences and through those challenges, I've learned a lot of lessons that I really want to help support the members in this detachment to try and be the best that they can be, try and help them achieve their goals, and in turn to achieve our mission of providing the best police service and public safety we can to the citizens of Kelowna.
Is there enough out there? We hear a lot about what's happening with EHS. Is there enough mental health supports for RCMP?
I really appreciate the question, and thank you for acknowledging today as World Suicide Prevention Day, and that's a very important topic for us. We do have supports available for our members, but we've all been impacted. I've personally been impacted by friends and colleagues who have taken their lives, and in the RCMP recently we've lost another member, and so these things are incredibly impactful. And there's some data that I'm aware of that 76% of Canadians may experience one critical incident in their life, whereas our police officers experience what they say is over 100 critical incidents in their career, and I would say that that number may be on the lower side. And so these things are incredibly impactful. They can be death, they can be suicides of other people, they can be entirely tragic events, and they're very impactful for our members. So we do have stuff set up such as peer support and other programs. We do have access to psychological care, but one of the important factors is that the majority of the programs that are set up are for post-exposure. So exposure happens and then the services and support happens. But we would never ask somebody who is an Olympic lifter or a power lifter to never train or never prepare in their life and then go and lift a 400-pound weight and try and be successful. They'd get injured. And so that impacts our police officers and all emergency responders in the same way, is that if we don't give them the foundational psychological and physical resilience that they require prior to exposure, then they're going to be injured more. And we know that they're going to have that exposure. So it's really important that not only we have a robust program for responding to these things, but we also have a robust program in advance to make sure we're preparing our folks to deal with this. And that's where I would say the gap is that we don't have all of those things available in the way that they should be. And so locally, we're going to do the best we can to start creating some of that stuff. And if there's a place for advocacy, I would say in any place in emergency services, having a foundation where we have strength and resilience for our folks to be able to better prepare them for those types of incidents is incredibly important. But we also want to encourage people that you have to be able to speak, and we have to create a safe environment that it's okay to be impacted these things, and it's okay to talk about it, and we have to check in on each other, because nothing is ever worth anybody taking their life, and there's always a way forward. And so we really want to make sure that we're creating that environment to not only support our people in advance of the trauma, supporting them through it, making them sure they're more resilient, and making sure that they can be healthy and well right through their career and into retirement. Yeah, I think it's important to recognize that nobody ever calls us to say, really, or I shouldn't say nobody, but it doesn't happen very often where somebody calls us and say they're having a great day. Our members are called to the worst moments of people's lives, and that's when they come. But not only does it happen one time, it happens over and over and over again during the course of the day. So these shifts and this work can be really impactful. It's very rewarding, and the service to the community is one of the greatest honors that we can possibly have, but the impact is felt. So we're working hard to make sure that we're supporting our members, but more work needs to be done.